One question comes up more often than you might think in my practice. Doc, is there something wrong with me? My semen volume just isn't what it used to be. And I want you to know, if you've ever wondered about this, you're not alone. It's a completely normal concern, and today we're going to talk about it openly, honestly, and with compassion. Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon, and if you ever face questions or concerns about your sexual health, your body, or anything related to urology, I hope you'll stay with us. We're here to help you understand your body with clarity, without shame, and with the kind of care you deserve. In this video, we're going to explore what semen actually is, how your body produces it, what influences its volume, and most importantly, what you can do if you've noticed changes. We'll also talk about whether this even matters to your partner, because sometimes the worry we carry is heavier than the reality. So let's take a breath, set the anxiety aside, and dive into the science with empathy. Understanding semen, what it is, and how your body makes it. Let's start with the basics. Semen is a remarkable fluid. Your body creates it through a beautiful, coordinated process involving several different organs. And here's something that might surprise you. Only about 5% of your semen is actually sperm. I know, most people assume it's much more. But the truth is, the vast majority of what makes up semen comes from other structures in your body, each playing a vital role. So where does the rest come from? Your prostate gland contributes about 20 to 30% of the total volume. The prostate produces a fluid that nourishes sperm and helps them move. Think of it as the fuel that keeps everything mobile and healthy. The seminal vesicles, two small pouch-like structures sitting just behind your prostate, provide the largest portion, around 60 to 70%. These glands store the fluid and release it during ejaculation. The bulbourethral glands, tiny glands near the urethra, add just a small amount right before ejaculation. It's a finishing touch, so to speak. And here's another layer, the force behind your ejaculation, whether it's a strong release or more of a gentle flow. Depends largely on muscles called the bulbocavernosus muscles. These muscles wrap around the urethra and contract rhythmically during climax, propelling semen forward. In some men, these muscles are naturally stronger, which creates a more forceful ejaculation. In others, they may be weaker or less toned, leading to a softer release. None of this determines fertility. None of it defines your masculinity. It's simply how your body works, and every body is different. Does semen volume actually matter to your partner? Now, let's address the elephant in the room. Many men worry that if their semen volume is lower, or if their ejaculation isn't as forceful, their partner might be disappointed, or worse, might think something is wrong with them. But here's what the research actually shows. In 2018, researchers surveyed 240 women and asked them directly, does your partner's semen, volume or ejaculation force affect your sexual satisfaction? The results were clear and reassuring. The vast majority of women said it didn't matter at all. Only 17% of women reported that their own orgasm felt stronger when their partner's ejaculation was noticeably forceful. A small group, 13%, said they sometimes wondered if low semen volume meant their partner wasn't as attracted to them, but this was more about their own insecurities, not actual dissatisfaction. So what does this tell us? Most partners care far more about emotional connection, mutual pleasure, and intimacy than they do about semen volume. If both people are experiencing pleasure and closeness, the rest is truly just detail. If you've been carrying worry about this, I want you to let it go. You're enough. Your body is enough. And your partner likely cares far less about this than you think. Why does semen volume decrease? So let's talk about what causes changes in semen volume, because understanding the why can help you feel more in control. Age first, age plays a natural role. Research shows that semen volume tends to peak in a man's 30s, and then gradually declines over time. This happens for a few reasons. Muscle tone decreases, hormone levels shift, and the glands that produce semen may slow down slightly. This is completely normal. It's not a sign of dysfunction. It's just your body aging, the same way your skin changes or your hair grays. Day-to-day variations. Even from day to day, your semen volume can fluctuate. Factors like hydration levels, are you drinking enough water? Stress, chronic stress affects everything, including sexual function. Medications, some drugs have side effects that reduce semen production. all play a role. So if you notice some variation, that's normal too. Medical causes. But what if you notice a sudden, persistent drop in semen volume? That's when I'd encourage you to see a urologist because there could be an underlying cause that needs attention. Some possibilities include ejaculatory duct obstruction. A blockage in the tubes that carry semen can reduce volume significantly. Low testosterone. Testosterone plays a role in semen production, so low levels can affect volume. Retrograde ejaculation. This is when semen flows backward into the bladder instead of forward during ejaculation. It can be caused by medications, especially tamsulosin, commonly prescribed for prostate issues, diabetes, neurological conditions, or spinal cord injuries. If you're experiencing this, please don't ignore it. A simple evaluation can help identify the cause and guide you toward the right solution. 4. Evidence-based ways to increase semen volume. All right, now let's talk about what you can do if you'd like to increase your semen volume. I'm going to give you 3 supportive strategies, and then one that's actually proven by research to make a measurable difference. 1. Quit smoking. I know, you've heard this before, but smoking is one of the most damaging habits for your entire body, including your sexual health. Smoking is linked to lung and bladder cancer, erectile dysfunction, reduced semen quality and volume. The theory is that smoking causes nerve damage and reduces the secretions needed to produce semen. So if you're a smoker, quitting is one of the best things you can do, not just for semen volume, but for your overall vitality and longevity. 2. Stay hydrated. This one's simple but often overlooked. Your body needs water to produce all of its fluids, including semen. A good rule of thumb: check the color of your urine. If it's a pale, lemonade-like yellow, you're well hydrated. If it's darker, you need more fluids. Proper hydration supports healthy semen production and keeps everything functioning smoothly. 3. Try Kegel exercises. Kegel exercises strengthen the pelvic floor muscles, including that bulbocavernosus muscle I mentioned earlier. When these muscles are strong, they contract more forcefully during ejaculation, which means you're more completely emptying your semen reserves. Now, I want to be clear. Kegel exercises aren't right for everyone. If you have chronic pelvic pain, urinary symptoms, or erectile dysfunction at a young age, these exercises might not help and could even make things worse. But if you're generally healthy and just want to improve pelvic muscle tone, they can be very effective. I have a full video on how to do Kegels correctly. Check it out if you're interested. A quick note on supplements. There are no FDA-approved supplements proven to increase semen volume. I know you'll see ads promising miracles, but the evidence just isn't there yet. Save your money and focus on the strategies we know actually work. 4. Ejaculate less frequently, the proven method. Here's the strategy with the strongest evidence behind it. Wait longer between ejaculations. Think of it like this: your body needs time to refill the tank. The more time you give it, the more semen it can produce. Researchers actually studied this. They followed 27 men over 16 months, collecting semen samples and tracking how long each man waited between ejaculations. Here's what they found. For every day of abstinence, semen volume increased by about 10%. In the first 4 days, the increase was even greater, around 12% per day. After 4 days, the rate of increase slowed to about 7 to 8% per day. So if you typically ejaculate daily and you wait 3 or 4 days, you'll notice a significant increase in volume. It's simple biology, and it works. Before we wrap up, I want to leave you with this thought. Your body is doing its best. It's working for you every single day in ways you may not even notice. And sometimes the changes we experience, whether it's semen volume, erection strength, or something else, are just part of being human. If something concerns you, don't suffer in silence. Talk to a doctor, ask questions, seek understanding. You deserve care, clarity, and compassion. And if you're here because you've been worried, take a deep breath. You're going to be okay. Most of the time, these concerns are far smaller than they feel in the moment. Thank you so much for watching today. If this video helped you, I hope you'll share it with someone who might need it too. We're all in this together, learning how to take better care of ourselves. and that's something worth celebrating. As always, remember to take care of yourself, because you're worth it.